Having talked with hundreds of parents about an ADHD diagnosis and the natural ways to help with it, there is still a lot of confusion on if a child actually has ADHD, what are the causes, and how can we help them without medications. In this video, we will look at ADHD through a lens that's different than just a diagnosis, unpacking it to see the symptoms, and then how the brain and nervous system influence these systems of the body that bring about the attention, focus, and impulse control struggles. Going back to a main root cause will help truly make sense of it and find answers to address the difficulties. Parents who are looking for medication and drug-free options, this video is for you. You might have heard from a teacher or a school administrator or even a counselor that medication is the only or the best option, but it's not congruent with your beliefs. Also, sometimes many dads and sometimes moms too attribute ADHD to being genetic. Kind of like if I struggled with this, then it makes sense that my child does too. We'll explore what ADHD really is, how to properly test for it, and most importantly, how to address the root causes of ADHD struggles. You'll learn about our unique approach that goes beyond traditional diagnoses and medication, offering a path to turn ADHD into a strength. Let's look at some eye-opening statistics. Recent data shows that ADHD affects about 6 million children in the United States alone. That's roughly 9.4% of children, and even more striking, ADHD diagnoses increased by 42% between 2003 and 2011. These numbers are staggering, but what's truly concerning is that many of these children are prescribed medication as a first-line treatment without exploring the root causes or alternative approaches. The good news is that here at Generations Chiropractic, we're seeing a growing trend of parents seeking more comprehensive drug-free solutions for their children's ADHD symptoms. First, it's crucial to understand that ADHD isn't a one-size-fits-all. There are different types, including a combined type, the hyperactive impulsive type, and the inattentive type. Each presents differently and requires a tailored and customizable approach. ADHD isn't just a busy, overwhelmed brain. The body can be overwhelming the brain as well, causing the entire central nervous system to be in fight or flight mode. And the question that most parents have is, where does this stress from the body or internal environment come from? The quick answer is from 4 key stressors that are often overlooked. Number 1 is a high stress or high risk pregnancy, where mom and baby are put into a sympathetic dominant state that shifts more of them into a fight or flight or a protective state. Number 2 is birth intervention, such as forceps, vacuum extraction, C-section, induction. This can place physical stress, that component, which is most commonly in the upper neck and the shoulders, which overwhelms the neuromotor development. Number 3 is being fussy or colicky as an infant with reflux or constipation struggles that continue to overwhelm the autonomic nervous system. And number 4 is the frequent ear and or respiratory infections before the age of 3, old and long with antibiotic use further adding stress to the autonomic system and the vagus nerve, which is that big brain-gut connection. When the nervous system gets overtaxed and overworked with these 4 stressors, the signals it sends to the brain are full-on protection, fight or flight response in every area of the brain. The cerebellum, which is the motor centers, which causes kids to not be able to sit, the midbrain or the limbic system, where it specifically the hippocampus, which affects focus and attention, and then the prefrontal cortex, where this region affects socialization, situational awareness, and the ability to self-calm and regulate. An overwhelmed body and brain can cause brain fog and focus and attention issues, and if not addressed, can be a huge energy drain for kids. This is actually quite common to see with ADHD. especially if they've struggled with all of the four causes above, to be more wound up and tired out instead of hyperactive. This happens for these main reasons. When the system is in sympathetic dominance for a long time, high energy, low sleep, constant stress, it eventually burns out and demotivation, tiredness, and grumpiness sets in. Yes, genetics can influence these behaviors, but not nearly as much as we think. The nervous system, the vagus nerve, and its developmental play a much greater role. In studies by Dr. Bruce Lipton, a PhD biologist who studies epigenetics, it is estimated that no more than 15% of our genetic code determines our outcomes. This means that 85% is up to us, influenced by our internal and external environment. This is incredibly encouraging, meaning that even though dad may struggle with attention and focus, etc., it doesn't mean that your kids do too. We often like to think of it as being primed. So the genetics kind of primes the environment, but it's what you give the environment that determines the outcome. So if we can change how the environment is and what we're adding to the genetic system, then we don't have to have the same outcome. Traditional ADHD tests often focus solely on symptoms, but here at Generations Chiropractic, we go deeper. Our INSiGHT Neurological Scans allow us to measure the exact amount of distress, dysfunction, and disorganization within the central or autonomic nervous system. This gives us a clear picture of what's really going on in the brain and body. For example, in a classic raging bull ADHD case, we might see a total energy index of over 350 when the optimal is 150 or less. In an inattentive drunken bull type, we might observe a pattern score of 50 to 100 when we want to see 100 to 150 be ideal. These metrics tell us more than a checklist of behaviors ever could. Instead of just addressing and trying to treat the symptoms, we focus on the underlying neurological imbalances. ADHD often stems from an overstressed, stuck, and out of balance nervous system. By addressing this root cause, we can create lasting change. Using the data from our scans, we create a customized care plan that's tailored to exactly what your child needs. There's no one-size-fits-all plan here. While medication has its place, we believe in exploring drug-free options first. Our approach aims to optimize brain function naturally, reducing or eliminating the need for medication in many cases. Perhaps most importantly, we help reframe ADHD. It's not just a disorder, it's a different way of processing information that, when properly managed, can lead to incredible creativity, productivity, and success. So if you're tired of feeling held back by ADHD, or if you're a parent watching your child struggle, it's time to take action. Don't let another day go by feeling overwhelmed or misunderstood. Visit our website or give us a call to schedule your INSiGHT Neurological Scans. Let's work together to uncover the root causes of your ADHD symptoms and create a personalized care plan to be able to use your ADHD as a superpower.